tear, it falls and hits the ground. A tree, it falls without a sound. A bird, it calls and sends you home. A man, he sits in the cold all alone.
Hi, Columbia. Welcome. Thank you so much for coming on today. Please introduce yourself and let our viewers know a little bit about you.
Hi, thank you for having me. My name's Columbia, and what I do, I work in apparel and fashion merchandising. I've been doing that for a little over 10 years. But outside of that, I just spend a lot of time with my husband. We like to do things outside, go camping, go to the ocean, go to the beach, just go everywhere and anywhere with our dogs and our cats. And yeah, but pretty much that's pretty much it.
Sounds really nice. You're on this event because you've gone through infertility or pregnancy loss. Can you tell us a little bit about your journey, sort of from the beginning, even if it goes all the way back to, when I found my husband, that's when I knew I wanted kids and so on.
Well, for me, I always knew that I wanted children, but it was kind of a when, when that happens. I always said when. It was never a question. I never wondered if I wanted kids, but there was definitely a lot of time in especially my early 20s where it was not something that I was focused on at that time in my life. It was always a later thing. And so my husband and I actually met in junior high school, but we didn't start dating until, gosh, what was I? 20, I was 26 when we started dating. So we knew each other for a really long time, but we just didn't get together until a little later in life. Yeah, I was 26, almost 27. And then we were together about 3 years, and we had bought a house and got our first dog. And I was turning 30, and it just kind of like became clear that continuing to be on birth control and prevent pregnancy just wasn't something that I wanted to do anymore. My husband and I, he still hadn't proposed or anything, but I knew that he was the person that I was going to be with. So I turned 30 in October of 2017. And by January of 2018, I was done being on birth control. And so my husband and I had a talk, and I was just told him, hey, you know, I don't want to keep taking this. I said, it's up to you if you want to talk about prevention, but I'm ready to like find out at least what my body is like without birth control. And that was the only conversation that we really had about it. It became apparent that he was kind of on the same page. Let's see what happens. But, things didn't happen very quickly. So yeah, January 2018 is when we officially started trying to conceive, which was 5 years ago now, which is crazy to even think about. And we spent our first several months doing the not trying, not preventing method of just, oh, it'll probably happen. And then through the summer into the fall, it became clear that like maybe it wasn't going to be so easy. And so then in August, I decided to go to the doctor and just have a quick chat with them and see if there was anything that I needed to know, because it had been 8 months, which wasn't, an eternity, but it was starting to feel like a long time. And my doctor didn't run any blood work, didn't do any testing at all, basically gave me the "you're young, just keep trying, it'll happen" speech, which I'm sure many people, many of us have heard. And so I was like, okay. And we just went on with our lives. And then 3 months later, in December of 2018, I did actually get my first positive pregnancy test. So after 11 months of trying to conceive, I got pregnant, which usually, they offer you the diagnosis of infertile once you hit the 12-month mark. So I was just so relieved. I was like, oh my gosh, I'm not infertile. It took a while, but maybe we just had to figure out our timing. And I was just so relieved when I got that positive pregnancy test. But without going into too much graphic detail, it did not pan out. I had my first pregnancy loss in January of 2019, and I was devastated. I was absolutely crushed. I was, of course, told it won't happen again. Your body just needs to figure this out, which is not a thing. There is no such thing as your body figuring out how to carry a pregnancy. You know, I got the it's just bad luck talk, all of those things. So I think we took about a month off to try to like find our bearings. And then we went back to trying to conceive. So we started trying to conceive again in February-ish, 2019. And nothing happened for a while. And then in September of 2019, so like, you know, another 7, 8 months later, I got a positive pregnancy test. And I was like, okay, this is it. Everybody said it won't happen again. I'm sure this time we're having a baby. And that time I had just started seeing a new doctor, and she put in orders to test my HCG, which is the pregnancy hormone. And I got a call from a nurse, and she was like, hey, you know, we got your blood work results. Your level went up and then it went down. And I was like, okay, what does that mean? And she's like, it means you're having a miscarriage. And I was just like, well, no, like, of course I'm not. Everybody said this wouldn't happen again, you know? And so that was the day before my birthday. And so on my 32nd birthday, I started bleeding, and I had, you know, the beginning of my second miscarriage. And that was you know, I always say for women who have multiple miscarriages that they all hurt in a new way. And that second miscarriage, the way that it hurt was not the like loss of innocence the way the first one was. It was much more the revelation that something was seriously wrong, and like a very big change in my hope for the future. So obviously that was a very difficult experience. And then also like it happening on my 32nd birthday, when, you know, turning 30 was kind of where I had decided that it was time to start trying. And all of a sudden, you know, 2 years had gone by, and all I had to show for it was like heartbreak. And so that was when I started my Instagram page. That was the day that I started my Instagram account, Yearning for Motherhood, which has been probably my biggest saving grace, my biggest source of sanity, is the community that I've found on that page in those years that have passed since that happened. And I'm so glad that I made the decision to do that day. So yeah, that was roughly the first 2 years of my loss journey. Um, and so with my new doctor, she decided to run a full panel of testing for recurrent loss, which, you know, every doctor has a different panel that they run. And I had no idea what it included. You know, I'm a researcher. I do a lot of my homework, but I was still relatively new to this world. And so while I was waiting for the results, I had 11 tubes of blood drawn. So I knew that she was running tests for a lot of things. So while I was waiting for those results, I was researching, and I decided that worst case scenario was I had a blood clotting disorder, because if I had a blood clotting disorder, then I knew I would have to be put on injectable medication in order to sustain a pregnancy. And at that time, that was my biggest fear, which foreshadowing.
Yeah, no one likes injections at all.
Well, I was terrified of needles.
Yeah, I'm
Terrified.
with you. I hate needles
Yeah,
so much.
I was terrified. And I was like, oh my God, if I get this diagnosis of blood clotting disorder, I'm going to have to do injections like that.
All the time.
I don't even know if I can do that, you know, which is very ironic now. But anyway, so all of the results back pretty quickly: normal, 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 thyroid, normal, autoimmune, normal. And I was like, well, this is good that everything's coming back normal. And then the last one was the blood clotting, and it came back normal. And I was like, great. And my doctor was like, well, there's one more. It takes a longer period of time to get the results of that, but it's really uncommon. And so I thought, of course, that one would come back normal. And that was the one that did not. And so the test is called a karyotype test, and it looks at your chromosomes. And that test revealed that I have a chromosomal abnormality called a balanced translocation, which, to put it very simply, I have all of my chromosomes. I have all of my genetic information in order to have a completely normal life and not have any disabilities or anything. But my chromosomes are arranged in a different way, which means that when it comes time for me to reproduce, since when you reproduce, only half of your chromosomes go into each egg, when it comes time for me to reproduce, that arrangement causes a lot more of my eggs to have abnormal chromosomal information, such as duplications or deletions, and therefore leads to a higher risk of miscarriage. It also can lead to a higher risk of carrying babies with birth defects. But each person who has a balanced translocation, it's very technical and there's a lot to explain to it. But basically, it's not a diagnosis where everyone who has balanced translocation has the same percentages, same odds, same outcomes. Everyone has a unique translocation,
Oh,
and which chromosomes are affected and where the breakpoints are on the chromosomes dictates what your odds are going to look like, basically. And there's still so much that they don't know and don't understand about it. But to make a long story short, people with balanced translocation have perfectly normal eggs in their arsenal as well. It's just a lottery, basically, of gambling, of trying to get a good egg versus an abnormal egg. And everyone has abnormal eggs, but people with balanced translocation have a higher percentage of them. And so what I was looking at was, I just got this diagnosis end of October 2019, and my husband now had just proposed to me, like literally the day before I got the diagnosis, which was kind of crazy. And so I said, okay, we're going to take a break from trying to conceive, and I'm going to go learn about this diagnosis and see what I can figure out, see what I can understand about what balanced translocation is, how that affects our chances of having a baby, how it affects my chances of having more miscarriages. Like, now is the perfect time for me to focus on planning my wedding and try to learn as much as I can to figure out the best path forward for us for our family building journey. And then the next month, I was tracking ovulation in order to prevent pregnancy because we had decided to take a break and learn about everything. And my body decided to ovulate 5 days earlier than normal. And so I had my very first surprise pregnancy. It was really kind of a sad moment because I took a pregnancy test just to make sure that I could drink wine on Thanksgiving. And it came up positive, and I was completely surprised, but there was no excitement. There was no joy. Instead of me seeing that positive pregnancy test and being like, oh my God, like we have a chance, like we're going to have a baby, I was just like, I had just gotten this diagnosis, and literally the only words I said were, I'm not ready to have another miscarriage right now. Like, I'm not ready to have a loss. And so I was very detached. I was very scared. And that pregnancy actually went very differently than the last two. I had HCG levels drawn. They were doubling perfectly. I went to my first ultrasound at 7 weeks, 3 days. Everything looked flawless. I had, baby had a heartbeat of 143. I mean, obviously I can recall all of these details, like everything. It was very special. And so I started to really soften to the idea. And I was like, okay, maybe instead of having a wedding, maybe we'll have a baby, and I was due 7 days after the date that I had picked for our wedding. So I paused all my wedding planning, and I was like, okay, I this is totally fine with me. I'd be perfectly happy to be blessed with a baby, and we can get married later. So yeah, 7 weeks, 3 days, everything looked perfect. And then we were going to go out of the country for a vacation. And I was just basically being an anxiety riddled pregnant after loss woman. And I was pushing my doctor. I said, can I get something just to know that everything's okay? She wouldn't give me an ultrasound. She said, you can come in for a Doppler appointment. So I said, fine, let's do that. So I went in at 10 weeks and 3 days to have an appointment just to check the baby's heartbeat, see if we could find it with a Doppler. They couldn't find it. They said, well, you're really early. Maybe we'll just get you in for an ultrasound really quickly. And I was excited. I was like, okay, yes, I get to see the baby after all, because I really had started to have so much faith in that pregnancy. And I'm sure you can gather where this is going. So yeah, we went into the ultrasound room, and there, the screen was silent. Everything was silent. Baby's heart had stopped beating. So yeah, they offered me the option to have a DNC procedure that same day to remove the pregnancy, which is such a sweet term. And so yeah, so I did that. So that was January of 2020 that I had my third loss. And that one, I mean, like I said, they all rock you in a new way. And that one really devastated me because I had kept my guard up, and then I managed to let it down, and then everything still went wrong, and I just started to feel like, how is anything ever going to go right? Like, it seemed like everything was perfect. So yeah, that was obviously really, really rough. And at that point, I just resumed wedding planning, and I said, okay, I definitely need a break. I can't go right back to trying to conceive right now. But that comes with its own set of, it messes with your mind as well to think about, like, oh, is this the month, when you're tracking ovulation and you see that positive, it's like, oh, am I missing this golden opportunity, but we took the time off until our wedding. So we got married in August of 2020, and then we went right back to it, right back to trying to conceive. And I guess, it used to take me a really long time to get pregnant, and it started to happen more frequently. So I don't know if maybe once I learned how to read ovulation tests better or what, but it just seemed like my husband and I had kind of like cracked the code for getting pregnant more easily for us personally. So I got pregnant shortly after our wedding, in October of 2020. And that was my first, what they refer to as a chemical pregnancy, where I pretty much knew from the time that I saw the positive test that it wasn't going to last, because it was such a faint positive and it just wasn't really getting darker. I still had my doctor book me in for HCG just so that I could have a record of the pregnancy. And so, yeah, my levels were just very, very low, and nothing really happened. And I started bleeding, I think 6 or 7 days after my period would have come. It was still horrible. It was still, mentally exhausting and physically not great, but yeah, so that was my first for sure chemical pregnancy. And then my doctor offered to put me on Clomid to help me ovulate better, which I still don't really understand what she meant by that. I've always ovulated late in my cycle, except for that one time that I ovulated 5 days early. And so, yeah, since I was ovulating late, that if I did a medication to help with ovulation, I would have a better chance of conceiving, I guess, every month. And so, yeah, she put me on Clomid. So I did 3 cycles of Clomid. It wasn't working. The side effects were terrible. So I asked if I could do letrozole instead, which is similar. And so she put me on letrozole. I did 1 month of that and ovulated like crazy early, like cycle day 9 or something like that. And so she's like, I don't think that that worked properly.
No.
Let's do one more Clomid. I was like, okay. And so I did one more cycle of Clomid, didn't get pregnant. And she had told me before I started, she's like, I'm only going to give you 5 months. And if you don't get pregnant with any of these, then, you should probably go to a fertility doctor anyway. Like, all right, fine. So my fifth assisted cycle failed, didn't get pregnant. This time I was starting to get pretty defeated because I expected, since we had gotten pregnant so many times naturally, that it would be, I don't want to say easy, but I expected that it would happen.
Yeah.
And so that time she's like, I think it's time for you to see a fertility doctor. And I was like, I think you're right. I think we have exhausted our resources here. I mean, I'd been seeing the same OB for years. She'd done a lot of testing for me. She'd always been in my corner, but I think her and I were both on the same page that, like, whatever was going on, she was not necessarily going to be able to help me.
Yeah.
Oh, and then to back up, while we were waiting to get married, while we were taking our break from trying to conceive, since I did have a D&C with that third pregnancy, I was able to send the baby for testing to see what the chromosomes looked like. And with my balanced translocation, I fully expected the baby to have chromosomal errors, and for that to be the cause of the loss. But that was the opposite was true. The baby was perfectly normal. It was a boy. And so therefore, even though I knew I had this diagnosis of balanced translocation that causes miscarriages, I also now had a miscarriage that I knew for sure was not caused by my balanced translocation. So that added to the, like, mental anguish for that loss heavily.
Yeah, well, yeah, because I had another lady who said that, like, that they had a perfectly great, fantastic egg, nothing wrong with it, and they had a miscarriage, and she was like, I was just like, what is this? Because there's no answers at all. Like, you don't even have one answer. I mean, I never got answers for mine. I didn't take anything for testing, so I have no idea. But I'm kind of glad, because so many women have told me, like, sometimes they get the nothing is wrong, it was perfect. Well, if it was perfect, why is it not there? You know what I mean? Like,
exactly.
Like, don't tell me it was perfect.
Yeah. Well, and especially because I was expecting that abnormal to be the answer because of the diagnosis that I was just given. And so I was just like, okay, so you're telling me that I'm on this quest to get a golden egg, and I got one and I lost him anyway.
Yeah.
So it was just, it was super devastating. So then back to the whole getting set up with a fertility doctor thing. The doctor I had been seeing, she said, you need to go see a fertility doctor. She told me to go to the clinic in town. I got set up, had the, what's it called, where you meet them for the first time and chit chat, consultation. I had the consultation, and I was just very disappointed. I had done a lot of research by this time about my balanced translocation diagnosis, and I understood it pretty well. And when I got in front of this doctor, the first thing she said to me was, so it looks like you might have a chromosomal translocation. And I was like, no, I do have one. And then she told me that because the baby was normal, if I was her client, she would never have tested me. She would have never done the karyotype test. She would have never diagnosed me with balanced translocation. And I'm like, I'm not sure you should have told me that, because I feel like this is the diagnosis that I need to have. And then she started telling me things about balanced translocation that were just false, like simply not true. Like, she didn't understand it as well as maybe she thought that she did. And it was only a 45-minute consultation, and it cost me $300, and none of it's covered. So it's just $300 out of my pocket. And then she spent about 10 minutes telling me about their COVID restrictions and guidelines and hand washing. And meanwhile, I'm sitting here with like 3 pages of notes, And I was trying to ask her all these questions and she cut me off and she was like, sorry, we're out of time. And I'm like, I just spent $300 to hear you talk to me about washing my hands and tell me stuff about my diagnosis that's like not true. So I was obviously very disappointed at that point. But one thing that she did say, because at that time, you know, I was like, I know I can get pregnant naturally. I know I can get these golden eggs. Why would I do IVF? I was like, I don't want to do IVF. And she said to me, well, unless you do IVF, she's like, you will not have more than one child. She said, you may be able to get lucky and have one child, but with your age, you won't have more than one. And I was like, oh, shit. You know, like that, I did not expect that. And of course, I took that with a grain of salt because I was like, okay, well, you're sitting here telling me other stuff that I don't know is true. So I don't know for sure if that is true. But, you know, one of the things that she wanted to focus on was looking at my egg reserve. And the doctor that I had been seeing, she did test my AMH, which is the hormone that tells you an idea of your egg reserve. And she said it was slightly low, but she wasn't concerned. And this new doctor was like, I want to do an AFC count, which is an ultrasound to look at your egg reserve, basically to get an idea of how many eggs you would get with an IVF retrieval in a given cycle. Your antral follicle count is what that is. It's like, I want to look at your AFC and, you know, see if your AMH hormone level is indicative of, you know, like if it's right, basically. I want to see how low you're running on eggs.
It sounds so bad. It's like, oh, you know, I want to see, like, you're running low on your, you know.
Yeah, yeah.
Just, like, I'm not a vending machine. Like,
yeah. If I am, I'm out of stock.
Am I?
I did that ultrasound with her, and you know, my AFC count was 8. And this is when I started learning about IVF, because even though I was still dead set against it, I was like, I really want to see, like, I want to have some information just to compare where am I landing. And I started seeing that all of these women are getting retrievals, you know, they're retrieving 20 plus eggs. And I'm like, oh, and I have 8. That's not good, you know? And so I kind of started hear more of her voice in my head of like, you'll never have more than one child unless you do IVF. But again, I was just not very pleased with this doctor in general. And so I started looking to see if there was any other options, because the doctor I had seen who referred me, she made it sound like there wasn't. It was basically like, this is the fertility clinic and this is where you go. And turns out there's another clinic in my town with another doctor, and that doctor is a man. And I was like, okay, do I really want a male doctor? You know? And
Yeah.
so I talked to the doctor that had referred me, and I was like, hey, why didn't you tell me about this other clinic? And she was like, well, you know, the other doctor doesn't have a great reputation for his bedside manner. And a lot of women prefer to have a female doctor. And I was like, okay, well, I'm just going to call and just see, you know? And so I called and asked how much it costs for a consultation. And they're like, oh, it's $300. And I'm like, do I really want to spend another $300 for another consultation? And I said, well, I'm seeing this other clinic. I was thinking about switching. And they said, oh, okay, well, in that case, we'll do your consultation for free. So, okay, then I will come down and I will meet your doctor. And you know, in this time, we're still trying to conceive. We're still, you know, going about it naturally. And then I was just, I don't know, I was softening more and more to the idea of IVF, especially because of the whole, I've always wanted kids, plural, you know, I've always wanted kind of a big family, actually. And so now, of course, I'm looking down the barrel of, am I ever going to have any kids at all? But it would be great if I could have one and the option to have more, you know? So I go and I do the consultation with this new doctor, and I walk in and he has a picture on his desk of my chromosomes. I had never even seen that before. He knew more about me than I knew about me. And he had this huge file of all this information that he had gotten from each doctor that I had seen. And this guy, I can understand why people don't think he's the most warm and fuzzy, but he knows his stuff. And so I was just instantly like, this is much more up to my speed. This is much more what I want, you know? And so I sat there and talked with him over an hour easily. I never felt like he was condescending towards me. Like, he just had this, it was a conversation, you know, instead of a like, I'm the doctor, you're the patient kind of thing. And so, yeah, I was just like, okay, this guy is the guy. And, you know, throughout the course of my conversation with him, it kind of just became more and more clear. And like I said, I was warming up to the idea of IVF anyway. And I was like, okay, if I want to do IVF, how do we do this? How do we get going? How do we get started right now? You know? And so then he had me meet with the financial team. Da, 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 da. I was there like 2.5 hours at this doctor's office, just meeting with different people and like getting all set up. And this person's going to be your nurse and this and that. And this appointment was on a Friday. And I left that appointment being like, okay, this is it. We're doing IVF. But I also noticed that my boobs were sore and I was 7 days past ovulation. And I was like, I'm pregnant. I know I'm pregnant. Just watch. Just watch me be pregnant. Because we were trying, you know. And sure enough, I took a pregnancy test on Monday, 10 days past ovulation, and there it was, positive, pregnancy number 5. And I was just like, this sounds horrible, but I was like, I'm going to be really mad if this is another miscarriage and basically all it does is just delay my chances of getting things going with this new fertility doctor and getting IVF started. Of course, as most people know, that's exactly what happened. Again, this pregnancy, my 5th pregnancy, I had perfect HCG levels. Everything was rising exactly as it should. Highest levels I'd ever had. I was like, okay, this is it. I'm going to go to this ultrasound. We're going to see a heartbeat. Like, doesn't mean it'll stay, but I fully expected to see a heartbeat at that first ultrasound. And instead, it was like, I got this very sweet ultrasound tech who wanted to assure me and encourage me. And I knew exactly how far along I would be. You know, I'm an expert at tracking my cycle by this time. And she's like, you're measuring, you know, I don't remember however many days. And it was like 3 or 4 days behind what I should have been. And I was like, okay, this is a miscarriage. I know this isn't happening. And she was just so adamant. She's like, no, you could just have your dates wrong. And I'm like, I don't. And she's like, it's just a little bit behind. You know, I've seen this before and you'll come back and everything will be great at your next appointment. And I'm like, you don't know my history. You know, it was just very much like she wanted it so badly for me that she did get in my head. She made me, okay, well, maybe, you know, maybe somehow this will be a miracle. It was not. I think I had ended up having 2 more ultrasounds to confirm because it was a situation where the sac kept growing.
Yeah. I know what you're talking about.
Yeah, a blighted ovum is what they call it.
I had one of those. Yeah.
Yeah. And so again, with a blighted ovum and with my balanced translocation diagnosis, fully expecting the result of the D&C to be abnormal, you know, and especially with a blighted ovum, they always say it's an abnormal embryo. That's why it grows like that. But I still opted to do a D&C because I wanted to test just to know, because what it was at this point, I was like, okay, I'm going to do IVF, and I want this pregnancy to be abnormal so that it will get me faith going into IVF that all I need is a normal embryo in order to have a successful pregnancy. Nope, perfectly normal. It was a girl. I'll never know why we lost her. Same exact thing as my third pregnancy. And again, with the balanced translocation, how did I get another normal embryo, and why did that end in a miscarriage?
Yeah.
And so at this point, I was just like, if there's one thing I know, it's that I can't do another normal or another natural pregnancy. I can't conceive on my own and have to spend those excruciating weeks after a positive test of wondering, is the baby normal? You know, is it growing? All of that. I was like, if I'm ever going to be pregnant again, I need to know as much as I possibly can about an embryo first.
Yeah.
Like that's what I learned from that pregnancy.
Yeah, I mean, that's the great thing about IVF, because they can test all the embryos and everything, and they can make sure that that is a normal one, and that it's
exactly
perfect. I mean, no one's perfect, and I don't think anyone
normal, yeah,
perfect, but you know, normal or as perfect as possible. But yeah, I totally get what you mean with the blighted ovum thing, because that was my first loss, and I was so taken aback. I didn't know you could have an egg sac thing growing inside you and there'd be no baby in it. Like, I didn't
right
know that the baby could not form, like could be there but not form properly, and then or
right
not form. It was so confusing to me, and I don't know if it tripped you out, but it tripped me out. I was like, huh, what is it, what is this, like, how is this
right
a thing?
well, like I said, I'm a researcher. I research everything like crazy, and so I started learning about embryo development after implantation. And so basically an embryo is too small to be visualized on an ultrasound, and then it implants into the uterine lining, and then it burrows into the uterine lining before it starts to grow. And so it has to get to a certain point of size before it comes back out, and that's when it becomes the fetal pole that you see. And so basically, from my understanding, a blighted ovum, it's not that the embryo is not there, it's that it just doesn't make it past that stage of being absorbed into the lining, and it's never big enough to visualize on ultrasound. Because I was like, okay, well, if there's no baby there, how are they able to test anything in a D&C? Like, what chromosomes are they looking at if there's nothing there? So that's why I dug into that, to try to understand what they were testing and how they were able to come up with a result to tell me if this baby had normal chromosomes or not. So that's my understanding, but it is really interesting that like your body doesn't recognize that the embryo has stopped developing, and that the sac continues to grow and the yolk sac continues to grow, and like you start to have this weird abnormal growth happening while the embryo has stopped developing.
Yeah.
And it also can be like a really mental thing to start to think about, because like, especially with my third loss where baby's heart had stopped and my body was just carrying on like normal, it's a really interesting thing in your mind of like, how did I not know? How did my body not know? You know, and it makes future pregnancies really, really scary, because you're like, is this going to happen again? Am I going to carry on thinking everything is fine when actually, you know, my baby's heart stopped beating weeks ago?
Yeah.
And so that is like a huge piece for me of pregnancy after loss, is that fear that your body isn't going to tell you what's happening.
Yeah, and you're sitting there like, oh yeah, I have a, you know, a living baby in me, and then you don't, like, because it's a mind F basically, because, you know, I went into the ultrasound at 6 weeks, and they said, look, we can't really see the embryo, but it's too early, we can't see it, because I didn't know dates or anything. And I was like, oh, okay, yeah, great, okay. And they're like, but we'll see a baby next time. So I was like, okay. So yeah, I go in for the second one and no baby, but the sack's bigger. And they're like, oh, well, we might have to wait another week. And you're just like, isn't it obvious?
The blighted ovum is especially torturous in that aspect of they have to be sure. Yeah. And so they keep having you come back for these ultrasounds. And like, especially if it's your first loss, you don't know, you know, like for me, my blighted ovum was my 5th loss. I was just like, can we just end this now? Like, I know that this is not going to be my miracle, and so to keep having to go in that like Schrodinger's pregnancy where you are both pregnant and also not pregnant at the same time, it's traumatic. It really messes with your head.
Yeah, and you get convinced that everything's going to be fine in that next ultrasound, and then you go in and they're like, nah, and you're like, dang it, seriously. And you were so hopeful.
I really wish that there was like some kind of feedback for these people because they see you at one ultrasound, they tell you everything's going to be fine at your next ultrasound. They never see you again. You never see the same tech, but you see this ultrasound tech and they promise you that everything is going to be fine. And then, they never see you again. And for all they know, it did turn out fine. There's no like responsibility for you to come back and be like, I told you, and you need to stop doing this to people.
Well, actually, I thankfully, I live in a small town. So we only have like one radiology clinic, and it's pretty much the one radiology like guy tech who does it, like the ultrasound. So I did get the same guy. He didn't remember me, but I got the same guy. It's like, yeah, you did my first loss. And he was just like, did I? Like,
oh, geez. I mean, I guess you're like, I remember you.
I remember you. You might not remember me. Maybe you see too many women. I don't know. Yeah. It's like, how many women are you seeing? Like
a lot, I'm sure.
Yeah, no, it's crazy. I think the amount of different experiences you've had as well, and you're knowledgeable. Like you look into this stuff. I love that you said you research. I know that normally means Google. Like I Google so much. Don't Google. Well, I'm going to, okay, because you don't really tell me much information, Mr. Doctor person, do you? So you kind of have to. Like you don't have a choice.
I think there's a lot to learn, and you just kind of have to like weed through it. And what I do is I'll find something and I'll try to determine if it's true as much as I possibly can off of the internet, and then I'll go and have a conversation with my actual doctor and be like, this is what I read. Am I off base here? Is this real? Is this true? And then also, like I said, that Instagram page that I started and that community that I get to talk to so many other women who also have these experiences and learn about this stuff. And like, I learn from them, they learn from me. We have this amazing like exchange of information so that we all end up more knowledgeable in the end. Advocacy has become just like such a huge part of like basically my personality at this point. Because I've had to switch doctors here and there. I've had to find the right questions to ask in order to get the answers that are actually going to be useful. And I wanted to believe once I switched to a fertility doctor and started forking out the big bucks that I wouldn't have to be the one leading the charge anymore. No, that's not true. Nobody's going to agonize over your case as much as you. You can't even expect them to. It doesn't matter how much money you're paying them. No one's going to care about you having a baby as much as you. It's just not the way the world works,
So true. And the other thing is, we're all human, including doctors. And
True.
they don't know everything. And like you said, you went into that clinic, and she, you're in this consultation, she's telling you things, and you're like, that's not true, that's not right, that's not right, because you've done your research. I've had the same experience, but with like midwives, and they've sort of said things, and I'm just like, well, that's not true. And it happens because as soon as you start doing your own research, you can like pick out that lie straight away. And I don't mean to say that they're lying, because maybe
Right.
that's true, and they haven't, really like delved. They haven't gone into it enough. And they think they've got everything figured out because they're a doctor and they've got a degree. But you can't keep all that information in your head about everything all the time. So you're going to miss out some things, and that's okay. But yeah, I did call my midwife up on it though. I was like, you're wrong. And then she was
Yeah.
like, actually, yeah, maybe I am wrong in that. But and I was like, but you're wrong.
Well, I think there's also like,
Own it.
just a huge change that happens once you spend so much time with doctors that like you do have that revelation, like they're just a human doing a job, and sometimes we make mistakes at our jobs. Everybody does.
That's right.
And so it's not like a bad thing to say about a doctor that they aren't necessarily right all the time. But it is a bad thing when you encounter a doctor who expects you to think that they're right all the time and doesn't like to be questioned and doesn't like to have any feedback or any active conversation. Like for me, that's the biggest red flag is when a doctor wants to have that I'm the doctor, you're the patient, I tell you what's happening. You don't ask me any questions. Like when I tell people about like how to advocate for themselves at the doctor, the number one question that I always tell people to ask is why. It's such a simple question, but when you stop your doctor, if they're telling you you need to do this, if you just ask them why, they need to be able to explain it to you. And it can be so scary to start off with that question, but once you do that, you start to realize that like you deserve that answer. You deserve the reasoning for everything that they tell you to do,
Yeah.
And it's just like it's why can you explain that to me a little better? I don't understand. Like these are such simple things to say, but they can get you to such a better place when you walk out of your doctor's office where you're like, okay, I don't feel like I just got hit by a tornado, you
Yeah.
know?
Well, even the like, what can I expect? Like, what can I expect? Like for what's it, side effects, and what's going to happen sort of next. Like, because when you're going for a miscarriage, I'm not sure whether you like, what were your options? Like, did you do? I know you said with the third you did a DNC, and with your fifth you did a DNC.
Yeah,
So
and the other three were natural.
the other three were natural. Okay, so okay, so with that, did they give you warning of anything, or did you just Google it?
So my first loss, I had an ultrasound at, very early ultrasound, and it was the classic, like, oh, the baby's just measuring small. We just come back in 2 weeks. There was no, when did you get your positive test again? Are you sure? There was no question to like try to determine if something was wrong. They just assumed I didn't know when I got pregnant and told me to come back in 2 weeks. And so I didn't expect to miscarry at all. And nobody told me, you might miscarry in the next 2 weeks. And if you do, here's what you can expect. I literally went home, went on with my life, was like, yeah, baby measured small, but they said that happens sometimes. And, I was so naive that I thought that everything would be fine. I was just waiting for my next ultrasound to like see that heartbeat and see that the baby had grown. And instead, it was a Friday night and I felt cramping and then I started bleeding and then it clicked for me. Then I was like, oh, okay, the reason that ultrasound didn't go the way that I had hoped it would go was because something was wrong, and now I'm miscarrying. And all I knew about miscarriage was everything that I had seen in,
Movies.
movies and TV. And so I thought that when I started bleeding, I thought that would be the worst part. And anybody who's had a natural miscarriage can tell you that when you start bleeding, that's not the worst part. It gets worse. It gets more painful, you know, and I had no idea. I just thought, okay, I know that a lot of doctors tell women it's like a heavy period,
That's
which
so
is
wrong.
a
So wrong.
gross underestimation of what it is. And again, there's no, it's very rare for you to go back to your doctor and be like, yeah, remember how you told me that it was like a heavy period? It wasn't like that. Stop telling women that. There's no like responsibility that they're being held to. And so, anyway, yeah, my first miscarriage was extremely traumatic physically because I didn't know what was happening. And like I said, when I started bleeding, I thought that that was the worst of it. And that was a Friday night. And so Saturday morning, my husband was like, he was going to go judge a snowboarding competition. And he's like, should I stay? I can stay. And I was like, no, I'm fine. And I was not fine. I didn't, I mean, I obviously I survived and everything. I didn't end up going to the ER or anything like that, but I definitely was like, wow, if I had known that it was going to be this painful and this physical, I definitely would not have told my husband to leave,
Yeah. Yeah.
So I think that that's like a huge area of improvement. Area room for improvement is doctors being more honest with women of saying, yeah, this ultrasound doesn't look good. And based on when you got your positive test, it's extremely likely that you're going to miscarry. And if you are, this is what you can expect. And I think there's a huge like, oh, we don't want to scare women. It's like, of course you don't want to scare women, but you also don't want to send them home to have an extremely traumatic experience with no idea what's happening.
Yeah, that's actually something we want to advocate for after this event, to actually advocate for like pamphlets and things to be given to women when they know they're going to miscarry.
Yeah.
So when they are sent home and they're like, oh yeah, I'll do it naturally, they're given that pamphlet, and the pamphlet kind of
Yeah.
this is what's going to happen. Here are the places where you can go to like listen to women and have some experiences behind you before you go through it yourself. Hopefully, you'll get a chance to watch some of them before it happens. Did you pass anything like for that first one? Like,
yes, I did.
Yeah.
Yeah. Yeah. And so I basically was, in bed all day in excruciating pain, which now I know was contractions, basically. And then at a certain point, I was like, I need to go to the bathroom. And I didn't know why. It was almost like like an animalistic thing. And so, yeah, I went to the bathroom, and that was when I passed what I thought was a large clot. Now, looking back, I know that it was the sac, but because I was so unprepared, I just had no idea what was happening.
Yeah. Yeah, I asked because I passed the sac. But by the time, because I found out I was miscarrying, or I knew I was miscarrying at about 6 weeks, and it took until about week 14 until my mom could pass it or was ready to pass it. And yeah, I labored for about 45 minutes, like really full on labor. I knew it was labor because I do have children here on earth. And when that happened, I was like, oh my gosh, this is labor. Like I'm actually contraction. Oh, this is ridiculous. And I like got on my hands, knees, did the things that you do, and I passed, and like sack. It was as big as like a large lemon, like a really big large lemon. It was
because they say, oh, if you're only 6 weeks pregnant, then you're only going to have this much. But if it took your body that long,
it keeps going.
Nothing everything is still.
Yeah,
your uterus is still filling up with things that have to come out.
Yeah.
My first loss, I was just past 9 weeks when I had my like the physical miscarriage. I don't think that the baby or the sac or anything ever really grew past the 7 week mark. But it was really validating for me when someone told me, like, okay, just because your baby was only 7 weeks doesn't mean that, you know, the other 2 weeks after that don't count towards how much this affected you physically, because, you know, there's still stuff. I'm like, okay, that makes sense, because yeah, it was even my chemical pregnancy, even the one that was basically just, you know, a week past my period, it was really physically, it was really painful, and it was definitely not, it was nothing like my normal period, and there was even then like still a small sac that was passed, and I was just like, I don't understand why they, like, a lot of doctors don't even really count chemical pregnancies as
Oh,
miscarriages at all,
I
which
could
is
talk about that.
absurd.
Yeah, I could talk about that for
Yeah,
hours. It actually angers me. It upsets me so much, because it's that whole thing.
yeah.
Oh, it's just a clump of cells. Freaking no, it isn't. If it was just a
You know
clump
what?
of cells, we would not get upset this much, and it would not hurt this much, and it would not, like, you know what I mean? It's
Well, I'm just a clump of cells. I'm a clump of cells that's, you know,
thing breathing.
5'6" and
Exactly.
all of those, but like everything is just a clump of cells.
I said that to my husband the other day. I was like, do you know what? No, they're not wrong. It is a clump of cells, but so are we. So, you know, he just laughed, because he's like with me in the mentality, because, you know, it just doesn't make sense to just be like, oh, well, it's not really anything. It's, well, if
Yeah,
that was true, it wouldn't hurt this much, and it wouldn't be this crappy. And like you said, once you test the blighted ovum, you can test to see like what sex it was, everything. And you've got the
yeah,
genetic code there. So if that's
yeah,
possible, then it was still a baby. It was still a like being. It may not have
yep,
gone very far, but it was still there. Oh, I
yeah.
went so long feeling like I was like being silly, and like
Hmm.
overly emotional about it. I don't know about you, like with the chemical um like miscarriage, like did you feel the same way? Like, oh, I feel silly,
I
but it's real.
I didn't, just because I had already been so immersed in the community for so
Oh,
long at that point. You know, I had talked to a lot of women who had had chemical pregnancies, and you know, seen a lot of the posts and talk about that, about like it wasn't a chemical, it was a baby, you know,
yeah,
and so like I already had that in my arsenal going into it, knowing that I was allowed to grieve, knowing that like it was valid for me to feel the way that I did, which I was thankful for. And like I've said, you know, just being a part of the community has just been so hugely helpful for me mentally. And that was one of the reasons why. Oh, and another thing I was going to say. So yeah, my two miscarriages, I had the DNC procedure, and the other three I had naturally. So I was given the option. I'm sure the drug has different names in different places, but misoprostol.
mm,
I was given the option to do the management with medication that basically induces labor and dilates your cervix and all of that. And luckily, because I was so immersed in the community, I had heard enough
yeah,
about that
no, not
to
to.
say, to opt out of it. So many women are given that drug and told it'll be like a heavy period. And I haven't experienced it, so I can't speak from
No, I know.
personal experience. But from what I have heard, it is so much more painful. You bleed so much more.
Oh yeah.
But it's like the mental aspect of like waiting to miscarry and not knowing, and also like if you know you're going to miscarry and you're waiting for your body to do it naturally,
Yeah,
how are you supposed to live your life?
you can't.
You know, like,
Can't.
oh, let me go to the grocery store, hopefully I don't start bleeding while I'm in the milk aisle,
Oh, I was
you
I was
know.
I was so wrecked for like 2 months, because that's how long it took. Like my body just
Yeah,
it just wasn't doing it. It just didn't know what was going on. So I'm like, just waiting. And it's torture, because you're like, the whole time, you know, something's dying inside of you, and you're just like, ew. Like, yeah, okay, if the baby's already died, yeah, but I'm talking about like the tissue as well. Like the tissue is like,
Right.
you know, it's everything is just so disgusting, and you're like, get out of me. Why have you not worked this out, body? And the
And
doctor's
you've
like,
heard,
oh, in 3 weeks your body should work it out. And then it's like 2
yeah,
months later, I'm like, are you freaking kidding? You know, and by that point I was like,
yeah,
oh, I've waited this long, I may as well wait for however long it's going to take for it to all just whatever it's going to do. But yeah, I'd looked at the pill as well. Don't do it. I've only heard of women passing out. Every woman I've spoken
really.
to has passed out. There's only one that didn't go to the hospital, and I said to her, why didn't you do that? And she was just like, I just wasn't in the mood. I was just really tired. But you
Sounds
could hide.
sounds like somebody who's had multiple losses to me. Like, yeah, I'm not going to the hospital this time.
I think it was her first loss, actually. And I just said to her,
Wow.
like, you're just a warrior woman. Because you know, if my husband had said to me, right, we're going to the hospital, I would have been like, okay, let's go, you know. But she was just like,
Yeah.
no, I just want to lay down. I was like, you're amazing. I wouldn't
Yeah.
do that. And you could have died, but you're amazing.
Yeah. I'm glad she didn't. I'm glad she
Yes,
managed to
she's
get through
alive,
that.
and she's had her rainbow, so she's
Oh,
good.
that's lovely.
But yes, no,
Yeah.
it's not I wouldn't recommend it. If you pass out, people, just go to the ER. Just
Yeah. I've also heard a lot about women getting physically sick, like puking and just hemorrhaging, just so it just I understand why women make that choice because surgical management is really expensive. It is surgery. You have to get put under anesthesia and then waiting to miscarry on your own, like you were describing. It's like, how do you live your life that way? And so the other option is to take the medication, which is much less expensive. And then you know when
and it
things are going to
happens.
happen.
Yeah, it happens pretty quickly,
Yeah.
isn't it? Yeah.
Yeah. And so I understand why women make that choice, but I just wish that doctors would be so much more honest about like, okay, here's this pill.
Mm.
It's going to be horrible.
And you
Like,
still might need a DNC, by the way, because I've known
yeah,
women who've had to
it
have
might
that.
not work.
So then they
Right.
have to feel it's traumatic, and then they have to go for a DNC as well and spend out for that too. So it just kind of,
Right.
it's not, no, it's just not ideal. Just, you know, think about it,
Yeah.
really mull it over before you make a decision, unless you've already done it and you
Right.
resonate with everything we've just said.
Yeah.
But yeah.
Yeah, it's definitely a big decision that to have to be faced with, especially because like you're in the middle of grieving at that time.
And
You
you know
know,
what?
you're
It's a sucky one. It's a sucky decision. You know, it's just
Mhm.
sucky. It's like, do you want this suck, or this suck? Which one?
Right. Yeah. Yeah. To wrap up with like
Yeah.
my story. So yeah, I had my fifth loss, blighted ovum. What was that? June of 2021. And basically I was like, as soon as my HCG is back down to like it solidified everything for me. I was like, we're moving on to IVF. As soon as my HCG is back down to 0, when's the soonest I can start, you know? But the question that I had for my doctor at that point, because then we found out that that fifth pregnancy was also normal. The question I had for my doctor is like, basically the only reason I was going to do IVF was to try to get normal embryos. And now here we have proof that I've miscarried normal babies twice. I said to him, why should I bother? Why should I bother putting my mind and body and bank account through this if I'm miscarrying normal embryos anyway and we don't know why? And my doctor was very honest with me. He said, I know your personality. I think from talking to you and spending time with you, he said, I feel like if you don't do it, you'll always wonder what would happen if you had. You'll always wonder if it could have worked. And I was like, damn it, you got me. Like,
And you know what? The other thing
true.
is they do monitor so much as well. Like there could be something that they monitor that maybe it wasn't caught on, through like the normal pregnancies, and maybe they'll catch something as you're going through it or something like that. Like, yeah.
A journey for me to try to choose to have faith that if I did get a normal embryo from IVF, that I would be able to have a successful pregnancy. It was literally up to me to make that decision in my own mind to say, okay, if I get a normal embryo, it could still work out. And so, yeah, we started the IVF process in September of 2021. I knew by this time, I understood that I had diminished ovarian reserve. So I knew we wouldn't get very many eggs per retrieval. I knew I had balanced translocation. So I knew that whatever embryos we did get, we were going to get more abnormal embryos than the average person. And I also knew that I had this history of miscarriage. And so I was like, I want to get as many eggs as I possibly can and as many embryos as I possibly can and try to, my goal was to hoard embryos. I wanted to get as many as I could and bank them. And so I talked to my doctor about the options available. A lot of people are like, okay, we're going to do IVF, and they sign up for one round. I learned that my clinic had an option that was, it was either you pay for one round. If it doesn't work, you pay for another round. You're looking at $25,000 per cycle.
Oh.
And everything included. And then they had an option that included 3 retrievals, but as soon as you got a normal embryo, you had to do a transfer. And I was like, no, I want to stockpile them. I'm not getting any younger. And if I did do that, and let's say amazing that it worked and I had a successful transfer, then I wouldn't have a chance to try again for a normal embryo until years later. And so I was like, what else do you got? And he's like, well, we do have this embryo banking program, but you have to be 40 years old. And I'm 34 at the time. And I'm like, okay, but with my diminished ovarian reserve and my balanced translocation, do you think that you could make an exception so that I could do this plan? And so he talked to the administration and they made an exception so that I could do this plan, this embryo banking plan that's usually reserved for women over 40, which was not very encouraging. I was like, the fact that I'm qualifying for this at 34 because of all the strikes against me is not really making me feel like this is going to go well.
They shouldn't have it like that anyway. They should make it specific to each woman, because in your case, and then that way you wouldn't be like, oh wow, I'm like a 40, I'm like 10 years older than my age, But I know what you mean. It's not, oh, I qualify.
Yeah, yay. It's like, oh wait, I don't know if I really wanted to qualify for this. But yeah, so that the clinic fee, so the amount of money that we had to pay to our clinic was $29,000, and it included 4 egg retrievals. And that didn't include any medications, any anesthesia, any biopsy, any genetic testing. That was literally just the amount of money to the clinic for them to do all my ultrasounds and do all my retrievals. And I had to use all 4 retrievals within a year. And so here I am. I had really gotten used to blood draws, but I'd never done a single injection because we never did any IUI or anything like that.
Yeah.
And here I am saying, yep, sign me up for 4 retrievals. And if you go to my Instagram and you find the video of my first injection, it's hilarious now. I was terrified. I was crying. I was running away from the needle. My poor sweet husband was trying to soothe me. And I was just an absolute mess. And I was like, what is wrong with me? How insane am I to sign up for 4 retrievals before ever doing a single injection?
You're not insane. It's just terrifying. You're not insane.
I'm just a very stubborn person, and I was like, this is our best chance and this is the best for the money and I can do it. I see women do IVF all the time. If they can do it, I can do it. That was my attitude.
Yeah.
But yeah, I didn't cope well with my first injection.
No, I look at those
Um,
women like and they've been doing it for a while, so I'm only seeing them like way later. But I'm like, you're amazing. I can't do that. That looks terrifying. You know, the ones where they get
I
their
was the
husbands
same
to do it, I'm
way.
like, yes, that's a
I,
bit more. Still, I don't know if I trust my husband with that.
I
Like, I love
started
my
off
husband.
having my husband do it, and I would literally cover my eyes. I couldn't even watch. I would literally cover my eyes
Oh,
and like
okay.
hold my breath, and it was a whole thing. It's hilarious to me now because yeah, by the time I got to that fourth retrieval, I was
Yeah,
1, 2, 3, hiya.
yeah. Let's do
Down.
this. You know.
Yeah. So yeah, so my first retrieval, we started meds in September of 2021, and it didn't go well. We only retrieved 5 eggs. I was super disappointed. But we managed to get 2 embryos out of those 5 eggs. And so I was like, okay, we got 2 embryos out of 5 eggs. This is really great. Now we just need to see if either one of them is normal. And I was like really hoping somehow that I would have this like 50-50 chance.
Yeah.
No, both of them were abnormal. So here we are, first round done, absolutely nothing, empty handed. And I was like super defeated, obviously. So then we start my second round. And by this time, I'm realizing that my diminished ovarian reserve is even worse than I had thought, because not only did we only get 5 eggs the first time, but the second time, but it took me a long time to get there too. Usually women stim for 9, 10, maybe 11 days. And I think I was 13 days that first retrieval. So I'm using a lot more medication too, which is also more money. I think my meds were about $400 a day of injections.
Oh, because they were trying to get more eggs at once. Like, was that the like?
Um, Yeah, just I was on the highest dose of everything because my body just doesn't respond very well because there's just not that much there to respond. So my second round on day 10, which is the day that a lot of women usually are like triggering and going into retrieval, my doctor was like, "Yeah, you've only got 2 follicles. I think you should cancel." And so we canceled my second round on day 10 after I think I had already done like 50 injections. It was insane. And so of course I was super defeated. And it was like, again, it was like, is one of those 2 follicles the one, you know? Am I missing it by not doing the retrieval? But also, will I ever do better? Will I have more than 2 follicles on our next round? So that was really difficult mentally. And then we moved on to my third round, and we made it to retrieval. So that was at that point, that was my goal. It was like, I just want to make it to
Yeah, it's better than
retrieval.
the other one. Yeah.
Yeah. And so we retrieved 9 eggs, and I was like, oh my gosh, this is great. But only 4 of them were mature. So then we're in a worse situation than we were with our first round. And then we got 0 embryos. None of them grew into embryos. And so we had nothing to send for testing. And so then I was just like, now I can't even make embryos, you know? So here I am, I've done 3 IVF cycles, I've done 2 retrievals, and we have absolutely nothing. And I'm just like, well, so much for hoarding embryos, so much for banking embryos. I just want one. I just want a chance to transfer. Like, I see all these women move on to transfer, and I'm just like, I want a giant needle in my butt. I want a chance, you know? Like, I, and of course I was getting super desensitized to injections by this point. So after that third round, I had a meeting with my doctor, and I was like, what else can we do? I said, when I did Clomid way back in the day, my progesterone was sky high. Like, it seemed I didn't get pregnant, but it seemed like I was producing a lot of eggs, a lot of follicles. Can we would it hurt to add that? And he was like, well, I don't think it would hurt, but let's do letrozole instead. He just preferred letrozole. And I was like, fine, okay, let's do letrozole. And so it's like, here I am doing all of these injections and then these 2 tiny little pills. And, what has the biggest effect? Who knows? Um, but my fourth round at retrieval, we retrieved 14. So it was
Wow.
a lot
Big
better, a
difference.
lot better. Yeah, and I really think that letrozole had a lot to do with it, combined with the fact that I'm doing all of these back to back to back. So there's like a cumulative effect. Yeah, like getting the hang of things, I guess. And so yeah, I got 14,
Wonderful.
I think 13 mature, 13 fertilized. So great fertilization. I was super encouraged. And then we got 2 embryos.
Okay.
So 11 of them never made it to the embryo stage. And I was like, again, comparing to my previous cycles, I'm like, what the hell? I got 2 embryos out of 5 on my first round. And then now here I am all excited to get 14 and I still only get 2 embryos.
Yeah.
So I really lost hope in that round at that point. I mean, we still sent them off for testing, but I was just like, it's going to be the same. They're both going to come back abnormal. And sure enough, they both came back abnormal. So here I am, 4 rounds in, 3 retrievals used up. I have 1 round left. And I will be honest, I was not hopeful. I did not anticipate ever getting a normal embryo at that point. I was just like, okay, well, for some reason, I was able to have these normal pregnancies that my body wasn't able to carry, or whatever reason they, didn't make it. And now I can't even get a normal embryo from an IVF cycle. I'm stabbing myself silly. I'm spending money like it's going out of style. It was so defeating and soul crushing. And that was about this time last year, January of 2022, that I had just had my 4th retrieval, and we were getting ready for my 5th one. And so, yeah, I mean, the 5th cycle for me was very much going through the motions. It was old hat, wake up, do my medication, go back to bed. Like, it was not even a big deal anymore. It just kind of felt like a day in the life to me. Wake up, go to my ultrasound, blah, 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 get the blood draw, wait for the nurse to call. It was just a part of life at that point. And so that round was my best one. I had 18 retrieved, which was insane, especially with my diminished ovarian reserve. And so I was feeling pretty encouraged by that. And then out of those 18, we managed to get 5 embryos. So here I am. I have 5 embryos from 1 round and 4 embryos total from all of my other rounds combined. So I'm like, okay, maybe we will get 1 normal. So we sent them off for testing. And then 2 weeks later, my nurse calls me and she's like, okay, so I got this report from the lab, but it's kind of confusing. Like, of course it is, you know. And she said, 2 of your embryos were abnormal. And she's like, and the other 3, it says they're normal. She's like, but it says that they want to do further testing because, basically, to simplify it, they were like, yeah, this is probably not right. Like, you probably don't actually have 3 embryos because of your translocation. And we think that maybe we just don't have your breakpoints on your chromosomes right. So we want to retest your blood and do this optical genome mapping test and look at your chromosomes again and make sure we have the breakpoints right, to make sure we have the probe right, to make it so technical. And like my head was just spinning. And I'm like, do I have normal embryos or not? And she's like, well, you have to come in on Monday, you have to do this other test, we have to send it off to the lab, we have to wait for it to come back, it'll be another 2 weeks. And I'm just like, of course it is. Of course it is. Of course it's another 2 weeks. But so in that time, you know me, I'm a researcher, I'm talking to everyone to see if anyone else has had this happen. No. I call the lab and talk to the geneticist at the lab, and I'm like, how many times have you seen this? And she's like, 3 times. And I'm like, okay, and what were the outcomes? She's like, well, one of them is you. Great. And she's like, and the other ones, one was before the optical genome mapping test existed. And the other one, we confirmed her result. And so I said, okay, let me put it to you this way. Do you think my embryos are normal and you're just trying to be sure? Or do you think that they are abnormal and you're trying to prove it? And she's like, I think that they're normal and we just want to make sure. So that was the encouragement that I needed to get through that additional 2-week period. And then, yeah, they called, and sure enough, my 3 embryos were perfectly normal, which was
Yay.
like the shock of a lifetime. And I was
Did you jump for joy?
like, oh yeah, I was beside myself, because there was no part of me that thought that would happen. I was like, I went from wanting to hoard embryos, wanting to have like at least 5 normal embryos, to if I could just get one, if I could just have a chance to transfer to see if this could work, it would be everything to me.
Yeah.
To just see if IVF could be different, if an IVF pregnancy could somehow be different than my natural pregnancies. And so, yeah, we finally got 3 normal embryos, and that was last March.
I'm guessing you froze them.
Yes, yes. So they have to be frozen in order to do the genetic testing, because they biopsy them and freeze them, and then they stay frozen while they wait for the result from the lab.
Yeah.
Yeah. So I had those 3 embryos sitting there frozen, and that was in March. I found out in the middle of April that they were normal because it took so long. And then I was like, okay, I'm not ready to just jump into a transfer. And so my doctor and I came up with a plan. We did a hysteroscopy to look at my uterus, look for polyps, look for any potential reason for those 2 normal losses that I had. Everything looked perfect. My friend took me to that one, and they tell you at the end of the appointment, like, yeah, everything looks perfect. Your uterus looks amazing. And you would think I would be happy. And I literally went out and got in my friend's car and started crying. And this super sweet nurse who works at my clinic, she like caught a glimpse of me, and she comes running out, and she's like, "What's wrong? Why are you crying?" And she's like giving me this big hug. And I was like, I just want to know why my babies aren't here. I just want a reason, And it's like, I didn't want anything to be wrong with my uterus, but I felt like that was my last chance for a reason for something to be wrong. And yeah, everything was great. And I was like, okay, well, I need to process this grief and focus on the fact that that is a positive thing moving into a transfer. But then I wanted to do the ERA to make sure that progesterone timing was perfect. I wanted to do the Emma and the Alice to look at my uterine lining for potential inflammation. And so we started that process, which is just the same as a transfer process. So all of these things were taking a lot of time. I did my hysteroscopy in April. I got set up for the ERA and started going through that process. And I did that in the middle of June. And then I did get an abnormal result for my ERA. I found out that I needed an additional 24 hours of progesterone. So I'm really glad that I did that. And so we weren't able to actually do our transfer until August. So it was 5 months from my retrieval until my transfer.
But they're tests
then,
as well. Like, you can only get those tests through IVF as well. A lot of those testings, in terms of making sure everything's prepped. So, like I said, like those
right.
lots that you had could have been a case of that was low, or like you had.
Well, I did have that doctor that I saw before I started seeing a fertility doctor. She did test my progesterone in my natural pregnancies, and so I knew that my progesterone was good. It was great, actually, and so that wasn't a cause for those losses, but it doesn't mean that everything was like perfectly regulated. You just can't know as much in a natural pregnancy as you can in an IVF pregnancy. I don't know what my lining was when I got pregnant. I don't know how thick my lining was or anything like that.
They just do so many tests. It's like crazy. But yeah, I know what you mean. So where are we now? Where are you right now? Like how like are you, like, what's happening?
Well, we finally did my transfer in August, and I found out 5 days after transfer that it worked. My embryo stuck, and I am now 25 weeks and 4 days pregnant. Yes. So everything with this pregnancy has been physically incredibly easy. He's looked perfect at every appointment. Everything has been so great and so encouraging. And, pregnancy after loss it's not for the weak. no part of this is for the weak, but you know what? We have to do it anyway.
Yeah.
But say I was told over and over, you're never going to be able to enjoy pregnancy. You know, you're going to be holding your breath until the day you hold them in your arms. And for me, that's not true. I had a very hard time in the first trimester, you know, because with all my previous losses, I was never able to get past that first trimester. But once I got past like the really like the 12-week mark was where I started to feel a shift and gain confidence that my body can do this. And really, it's interesting because I, it's easy for me to like not trust my body, but I feel so much confidence in this baby, which is like weird to say, but I'm like, I feel like he's strong. He was a great embryo, beautiful, graded 5AA, hatching on the day we did our transfer. And he's just been great at every appointment ever since. And so I feel like he gives me confidence in this pregnancy. And so yeah, around the beginning of second trimester, I started to feel a shift, and like I definitely still have fear. I'm very aware that no point in pregnancy is a guarantee. Things could still go wrong for me. Of course, I hope they don't. I'm aware of that, but I feel like my excitement is bigger than my fear. And I'm so happy for that because I didn't anticipate it. I was really scared that I would spend my entire pregnancy just paralyzed by fear. And so, yeah, I'm really glad that that's not the case.
Well, I'm so glad for you, and I'll be praying for your rainbow and for him to be in
Thank
your
you.
arms on your due date, screaming, because that's the way babies are supposed to be.
I will be very happy the first time I hear him scream.
Yeah. Oh yeah. I had one of my children were born and he wasn't screaming, and it was terrifying. So screaming is good, but even if they're not screaming,
Yes.
it doesn't mean you terrible things straight away. So yeah.
Right.
I was holding him and it was just so listless. It was horrible. But yes, he was okay in the end. But yeah, it's screaming and healthy. I will pray for it. But that's so great in 25 weeks and everything's looking promising. That's amazing. And I think it's just a testament to what we can do these days, with the proper kind of testing and seeing what's going on in there, and yeah, just trying to fill in all the gaps. But yeah, I mean, look, we will never get answers for the losses we've had.
Right.
Like, we can pretend it's lots of different things and be like, no, it's definitely this. But we won't know.
I'll always wonder why this baby is here and kicking and growing, and why, you know, at least the other two that I knew were normal. I'll always wonder why they aren't. And that's always difficult for me. The three that I lost naturally that I never had any opportunity to test, it's easy for me to just say, I'm sure it was chromosomal. I'm sure it was my
Yeah,
balance
I do that.
translocation,
Yeah, I do that.
and that helps me.
Mm.
But, I think the thing that happens now that I am pregnant and everything is going well, if I talk to people, and I don't mean like people like you, I mean like, just my hairdresser or whoever, if I say anything about how hard it was to get here, because I'm very open about my journey, everybody knows what we went through. Um, People are really quick to say to me, well, it was all worth it. And I'm like, I don't, you don't get to decide that.
Don't
I'll
say
tell
that.
if I feel like it was all worth it, I will say that. Do I feel like my last round of IVF was worth it? Sure. Do I feel like the 4 that failed were? No. And like, I certainly don't feel like my pregnancy losses, like my miscarriages, were worth it in any
No.
capacity. Like,
But you can see the silver, like you can go, right, I can see the silver linings, like that, okay, that allowed me to know this. But no, it's not a good thing. It's not like, oh yeah, well, thank goodness for that. Now I've
yeah,
like
I just don't think of losing my babies as a means to an end of like, oh, well, I had to lose that one in order to have this one. Like that's a very strange way to think
No,
to
I
me,
think,
and I don't.
yeah, for me, I'm like, well, that, like, if, well, in this pregnancy, I would have had my first loss in December. So I'm pregnant right now, and I'm 20 weeks.
Oh, awesome.
But I would have had the baby in December, so December was really crap. But but I was like, well, if I had that baby, I wouldn't be pregnant with this one. So then I was like,
Yeah,
well, I'm not grateful for losing the baby,
right.
obviously, but I'm like, I need to focus on this one and be grateful for this one. And I believe my baby's in heaven, so I'm just like, I hope you're okay over there. But then I'm just kind of like that, because I felt guilty at one point. I was like, oh my gosh, I can't be upset about this one because of this one. And then I was like, no, I'm allowed to be upset about losing a child, and I do need to focus
Regardless.
yeah, regardless. And
Yeah.
it's fine to feel that way. But yeah, it was really odd for me because I was like, I wouldn't be pregnant with this specific baby right now if I'd had that other one. So then I'm like, mind, like, just mind too much.
There's one thing, I mean, I've learned so much over the last 5 years about grief, especially, with going through all my losses. And like one of the things that I actually went to this grief class, which I didn't know was a thing, but my friend's mom offered to take me. And one of the things the instructor said is like, don't get lost in the shoulds. Don't should yourself. There is no right way to feel in grief. There is no, oh, I should feel this way. I should feel that way. You're perfectly allowed to feel however you feel, even if people don't understand it, and also just a lot of things I've learned about like what can coexist, and you can feel very happy about the current pregnancy and also feel very sad about the baby that you don't get to have. And those things don't have to overlap. They can just be two things that exist and that's it, you know? So I don't know. I've definitely learned so much. And like, again, being in the community, talking to other women who've gone through loss, and not just miscarriage, but, the various types of losses that infertility brings. Loss of how you pictured your family, loss of embryos. There's so much grief in the process. And so understanding that and giving yourself permission to grieve is just like, it really makes makes survival a little easier.
I think understanding like infertility is a loss within itself as well, because like some women just they don't even get to the point of pregnancy loss because there's just no pregnancy. So that in
Yeah.
itself is a loss because
Yeah.
you have to deal with that reality of not being able to even get to the pregnancy point. And I think that
Right.
like validating that, it's amazing how we need this validation as well. Like we need to like be like, is this normal? Is this okay? And yes, it is. And we're allowed to
Yeah.
be really sad about it. And we're women, so we get really emotional about everything.
Yeah.
Especially you and me now, because 25 weeks and 20 weeks.
Yeah.
Quite a
I
few.
don't know. I feel like I was telling my husband this. I was like, I don't know if maybe it just hasn't hit me, but I think what it is I've been on so many hormones for so long, because basically from the time I started IVF in September of 2021 until now, I have been on I have been on a hormonal roller coaster with very high highs and very low lows for so long
But you
that
can
like
blame the medication.
even like I think this is just who I am now. Sorry. Like I think that I'm just a hormonal woman forever.
Gosh.
Like
Yeah. And your husband's like, so normal? No, it
yeah,
doesn't exist.
yeah, he doesn't even know what
Forget
normal
it.
is anymore.
Yeah. But I feel bad for the men sometimes. I know we go through all of this emotionally, physically, but I do feel bad for them too, because they're just watching it and they don't understand it. They can't feel it from the same perspective. And they're just kind of like, I'm just on this roller coaster and I can't even choose how fast we're going. It's just going.
Yeah. There's definitely been a learning curve with my husband of, my grief and his grief being so different, him not understanding how I'm feeling, like it's definitely a huge piece of this, especially because of the loneliness, that you end up feeling. You feel like you're on your own in your grief, even though your partner, it's his child too.
Yeah.
But he's just like, I didn't have that in my body. I don't feel it. I don't understand it the way that you do. And I think also it just really depends on the man. My husband is very good at hiding all of his emotions, and he also is always, he focuses so heavily on being there for me that
Yeah.
I don't think he even allows himself to process things fully at
Yeah.
all.
Almost like he wouldn't know what he's feeling anyway, because he's busy being stoic and being the man.
Exactly.
Yeah. Yeah.
Yep.
So true. And my husband's kind of like there with yours, so you're all good.
Yeah.
Yeah, no, it's crazy. To wrap it up, I just want to ask, how are you feeling right now? I mean, 25 weeks, that's great, like getting this far, and yeah, are you making any plans, like having baby showers, making the baby room?
Yeah.
I'm so reluctant to do anything.
Yeah.
But yeah, how are you going?
So I actually booked the venue for my baby shower today. Um, it feels very surreal to do any of it, but like I'm a the job that I've done includes a lot of logistics for the last several years. And so to me, I kind of just take it on as like this other, like a task, like, okay, I need to do this, I need to do that, I need to do this. And I think on the day of when I actually have a baby shower and like show up and I'm like, this is my baby shower, I'm going to be a complete emotional puddle, you know? But right now I'm feeling excited. I'm feeling very hopeful that everything will continue well for this pregnancy, but I'm also feeling very overwhelmed by all of the things that we need to do. The baby shower, that's easy. It's not that, it's not that big of a deal, but like we have this massive like remodeling project that we need to do in order to set up a baby room, and we have not really
Oh,
started.
you know what? I didn't do a baby room. Well, we did, but we didn't use it ever.
Yeah.
We co-slept, and that worked amazing for us because I wasn't getting enough sleep, and it was just a mess. So I just co-slept, and
Yeah.
sometimes that can work better. And if you don't get the baby room done, get one of those like co-sleepers. If you don't want to have them in the bed, you can get like because then there's less stress on you.
Yeah.
Still do the room. It just might be a year or so later.
Yeah. I honestly think baby will not be in his own room for probably a few years.
Yeah, honestly, I still check their breathing. Like
Yeah.
my youngest is 2 and a bit, and I still check his breathing. I check all of them all the time. So yeah,
I
it's
have a feeling I'll be the same way. I mean,
yeah,
once you know loss in one aspect of your life, it changes everything. It
oh
changes
yeah,
your perspective on the world, and you're just so hyper aware of like the fragility of life in general. I've talked to a lot of women about like how going through loss like affects just their life in general, and the anxiety levels and worry about things going wrong. And
and it's
I
literally
think it's kind of inevitable.
yeah,
Yeah.
yeah, and it's normal, and we're gonna have to live with it now. But
Yeah.
I think it gets easier with time. That's what I've been told. Everyone says time heals all wounds, and it really is true, even with pregnancy loss. But
Yeah.
I have taken up a lot of your time, so I am very sorry. Way longer than
You're
I
good.
said it would.
My husband just got home with tacos, so
Oh, yum!
it's time to go.
Good husband.
But appreciate you taking the time. It was great to chat with you. And if you have any other questions or anything, feel free to contact me.
Thank you so much for
Yeah.
joining me and chatting with me. And yeah, it's been really, really great to have you here.
Yeah, I really appreciate it. I will chat with you soon.
Please note that all speakers, including experts and professionals, express information, views, and opinions that should not be used to diagnose, treat, cure, or prevent any medical conditions. If you have a medical issue, please consult a qualified professional. Speakers voice their own views, opinions, and conclusions, and they may not reflect the views, opinions, and conclusions of other speakers. Ella Rose, The Joy of Sunflowers, and its sponsors may not endorse all or any of the views, opinions, or conclusions expressed.